Hello, Darius. I am Declan. I'm your student athletic therapist. Today we'll go over our plan of care for the Dequervains Tenosynovitis. So just to go over what it is inflammation of tendons on the radial side of the wrist and the base of the thumb, specifically the abductor pollicis longus and extensor pollicis brevis. It occurs when these tendons are compressed by the seat that they pass through. So potential issues that this come with is that you feel like a pinch, and it will impair your grasp by making it painful and making it not as strong. It's going to impair your writing, or maybe daily activities like lifting cup, drinking, and all that stuff. It's going to give like some swelling around the area, and it's going to impair your range of motion a little as well. It's going to give you some restrictions and limitations when it comes to your daily tasks, like I said earlier, with writing, gripping, opening bags, closing bags, all that stuff. With sports, maybe with lifting weights, holding a racket, or like holding a paddle. So with our primary goal, we want to focus on some more occupational related issues, kind of like making sure like you can write, you can type pain free. So all those wrist movements you can do, like flexion, extension, ulnar radial deviation, all this stuff pain free. And we also want to make sure the sport related symptoms will be cleared as well. So we will work on your grip strength, and also working on like pushing the fluid away from that area to make sure like there's less pinching around that seat, so there will be less pain. We want to make sure there's no swelling, as I was talking about. So our intervention plan is that we're going to use ultrasound. We're going to use 3 millihertz, just so like it's for surface, like more surface structures. So we'll use a non-thermal setting, because for subacute there still might be a lot of heat in the area. We don't want to overheat the area by using thermal function. We're going to use 0.5 watts per centimeters. Just because like if it goes higher, the intensity, it will again like it will heat up the area too much, which we don't want, because like there's already a lot of pinching in the area. And we're to avoid further aggravation of the symptoms, we're going to go on a 2:1 ratio of pulse rate. So it will heat for like 2 seconds and then stop for 1, just to make sure like we're not overheating the area again. So it's just enough so that they can bring in more healing factors and all that stuff, help it recover. We'll do that twice a week, 5 minutes each time, and we'll do it over the first dorsal compartment of the wrist. We're also going to do mobilization movements. So we're going to do a radial glide on the proximal row of the carpal bone to facilitate ulnar deviation. So kind of, I'll put your arm down on things like this with your wrist dangling down. When we do this, kind of, to do ulnar deviation. We're going to do it with movement. So you're going to abduct and adduct your thumb while doing it. We're going to do 3 sets of 10 reps, going at a glide of grade 2 to 3. And then for exercises, we're going to start with essentially loading your wrist. So we're going to have your forearm dangling off a cliff, holding up with the hammer curl position. You're just slowly lowering down. We're going to do some easier exercises so it doesn't overload your tendons too much. And then you're going to lift it up, go down, lift it up again. We'll do 3 to 10 each time. We ideally do it every single day. And then we're going to go for more resistant exercises, like using an elastic band between your fingers to work your thumb movements. And then we're going to use like grip stress balls or like grippers to like work on your grip strength. So the visit plan is to have you to come visit us 3 sessions a week. We'll do ultrasound to start, just to heat up the tissues. And we're going to do a soft tissue massage in the first dorsal compartment of the wrist for 5 to 7 minutes to push out the fluids. We're going to do traction just to make it more mobile, so we can do like the exercise and all that stuff. We're going to do the exercises. We'll do stretching first, something like this, something like phalanx, reverse phalanx, just to like open up again, just to make it more mobile before we get to the exercises, which will change based on how you are progressing. And after that, we're going to, let's talk about the return to play criteria. We just want to make sure you have full range of motion of the wrist with no pain. We're ability for you to type, write, do work with no pain as well. Maybe do weights, cycling with no pain, with full strength and all that stuff. Making sure you have 95% of strength with your glute muscles, and making sure there's a negative test for Finkelstein test, and that will be about it. Got any questions?
No, that's all explained well. Thank you.
Perfect.